South Dakota physicians to support Initiative Measure 11, which will prohibit abortion as a means of birth control in the state of South Dakota. Measure 11 does, however, allow for medically necessary terminations of pregnancy that follow standard medical practice to prevent the death or health impairment of the mother and those pregnancies resulting from rape or incest that are reported to law enforcement. A recent television ad in opposition to Measure 11 depicts the story of a patient affected by Twin-Twin Transfusion Syndrome and misleads the public to believe that Initiative Measure 11 will limit physicians' normal and customary care of pregnant patients and not allow us to carry out medically indicated plans and procedures as necessary. This, of course, is not true. There are multiple ways to treat Twin-Twin Transfusion Syndrome, and there are no perfect treatments. Please remember that these procedures are highly technical, and most are not available in South Dakota. It is also important to remember that if the intent of an accepted medically indicated procedure is not to end a life, but to save a life, this would be covered under Measure 11. The intent of Measure 11 is not to prosecute a physician whose goal is to save lives, but to end abortion as a means of birth control. Television ads like the one previously mentioned are misrepresenting the true intent of this measure. Initiative Measure 11 does not preclude the use of standard medical procedures with the goal of life and health. It prevents abortion as a means of birth control. Thank you for your time and attention.
Questions?
Any questions? Recently, the South Dakota Medical Association announced that they are opposed to this measure, and I'm not sure if you guys are all members of this association, but they publicly came out, which they did not do in 2006, and said that they oppose this. Your response to that?
I'm not a member. I'm Dr. Oliver. I'm not a member of the Medical Association. I haven't read their press release or their statement, so I really can't comment. If what you say is true, then I'm disappointed at my fellow physicians that are not standing up for life and supporting the oath that they swore when they became physicians.
Sorry, can I get your first name just real quick? Donald Oliver.
Yes, I'm a pediatrician. I've been a pediatrician here in Rapid City for 28 years.
Where exactly on the proposed measure does it say that with this commercial that you guys are talking about, where exactly on the measure does it say that it would be okay in that instance?
The bill does refer to standard medical practice with the goal to extend life and health
Of the mother.
of everyone.
Can you give us a section where the wording is that specific?
I cannot. I don't have the bill in front of me.
Is there any other doctor here that can comment if you are a member of the South Dakota Medical Association?
Not a member of that association.
No.
And haven't read it either.
Dr. Schmagel, are you a member?
I am a member.
Okay, can you comment? They had a press conference this morning, I'm sure, as you...
I was a minority in the vote, apparently.
Do you have a comment on...
Not anything further than what Dr. Oliver said.
And we'd be happy to look at what the South Dakota State Medical Association or the ACOG, the American, or the South Dakota chapter of the oncology group has to say, but we have not been advised of that right now, so we would look at it down the road and assess that. But the way we look at Measure 11, the intent of the bill is to save lives, to not use the abortions for birth control, which is 97 to 98% of abortions that are done in South Dakota are for this. There's no South Dakota physicians that do abortions in this bill. They're all done by Minnesota physicians in the Sioux Falls Planned Parenthood clinic. I agree with Dr. Oliver. In the bill, specifically with the twin-twin transfusion, if the intent is to save a life rather than to terminate a life, there's no violation with the standard medical procedures that are done for twin-twin transfusions. There's laser treatments that can be done for the placenta, intrautero. There's treatments of the umbilical cord that can be done, and those are all being intent. So there are specific things in the bill that we looked at, and the word being intent and standard medical practice. means that they're following. We know it's standard medical practice. It is not a violation of the bill. Where this procedure is done for the patient that's in the ad was in Ohio, I believe. There is no one in South Dakota that does that procedure there. However, if there were, the intent is still to attempt to save the lives of both of them who are children. It's not a violation of the bill. We disagree that this would not be able to be performed here in South Dakota under the bill.
Can you come up a little bit closer to your microphones, and a follow-up to that? Do you believe because there's the word intent in there, it's all encompassing for anything that could happen? Because a lot of people are saying the wording is so loosely languaged in this measure that no doctor would touch a patient to help save her life or the baby's life because they were afraid of criminal prosecution.
Understood. And you'll hear that from the people that are opposed to this bill that I would argue are pro-abortion positions. It is clearly stated about intent, standard medical practice, and following measures to do the best possible to save the life of the mother and the child. If there is a loss of the child with the intent and the standard medical practice, that is no violation. As a general surgeon, that's what I do. I know exactly what I'm supposed to do. I follow what is standard practice. And if a complication would occur, that would be different. So same with OB, if we're delivering a child where our intent is to save the child's life, there is no violation. So that's how we look at twin-twin transfusion. And the comments about other physicians saying they wouldn't do this, that's not what you're hearing from the pro-life stance. We feel that basically all standard medical care can be rendered by an obstetrician in South Dakota under this bill.
And you wouldn't render, or you wouldn't delay that care to check with lawyers, hospital lawyers,
No.
anything like that?
No.
Because,
This
when
bill
bureaucracy is in place in a medical room, it can make the process longer.
This bill was written by the Attorney General of South Dakota, and over an 8-month period, him and 11 other legal experts wrote this bill, so it is perfected as we feel it to be. We've covered all the bases for it, so standard medical practice being followed. If the intent is to go into to terminate a life, that's bad intent. If the intent is not to do that, there should not be an issue.
I would just like to simply say, as a practicing obstetrician and gynecologist in the state of South Dakota, I will not change my management or care of patients in South Dakota if this bill passes. This law becomes effective. And I take care of those scenarios, those patients that have high-risk pregnancies. I take care of ladies that have concerning things that I may have to consider terminating a pregnancy before the age of viability. So it's not going to change the way I practice medicine. I'm not going to let the lawyers dictate how I practice medicine.
Dr. Oliver, again, I believe many in the public and the media as well are missing the point in this debate over initiated measure 11. If you remember, South Dakotans for Healthy Families campaigned the last time. Their entire campaign was no exceptions, no exceptions, no exceptions. Implying, of course, that if there were exceptions, that they would favor the bill. Well, we've come back, and this bill